Hello, thank you so much for joining me today for this brief presentation, which I've entitled Cannabis Syndrome, Cannabis Hyperemesis Syndrome, which is abbreviated CHS. This is a big deal, so listen up. I'll begin with a disclaimer that the information I'll be presenting right now is for your educational purposes only. It's not meant to substitute for sound medical or health advice. So, what is cannabis hyperemesis syndrome? This is new to almost anyone. No one's heard of this. So let's just dive into it. So CHS is a relatively rare condition caused by long-term and heavy use of cannabis. It leads to cycles of severe nausea, vomiting, and abdominal pain. Very common symptoms in medicine, and because of that, it takes doctors quite a while to diagnose this condition, particularly if they don't really know about it. Also, it's a misunderstood and often misdiagnosed condition as it mimics many gastrointestinal disorders. Now, there is a relationship between the gut, your intestinal tract, and your brain, and that is namely the gut-brain connection. And here's what I mean. Chronic cannabis overuse stimulates what are known as CB1 receptors in the brain and the gut, and that means there'll be a disruption of normal gastric motility, the movement of the intestinal tract, particularly the stomach and small intestine, and that leads to persistent nausea and vomiting. Prolonged activation of these receptors, the CB1 receptors, desensitizes their anti-nausea effects, which means desensitization of anti-nausea means you will get nauseous, making users of cannabis paradoxically more prone to vomiting over time. And cannabis metabolites accumulate in fat tissues, causing prolonged effects and triggering recurrent cycles of hyperemesis even after stopping its use. So, what can CHS, when can it occur? Number one, it typically occurs in individuals who use cannabis regularly for months or even years. And even though you may have not experienced this yet, you might in the future. So we want to have a mental appreciation of it and awareness of it. And if you do smoke cannabis, when you visit your doctor, particularly if you have unexplained symptoms, you want to mention the use of cannabis, particularly if you're not asked. So cannabis symptoms tend to develop or hyperemesis symptoms, I should say, in three phases. The first phase is the prodromal phase, where there's nausea, morning sickness, and anxiety. Imagine that. Imagine feeling anxious because of cannabis smoking, let's say, or use of gummies. And then there's a hyperemetic phase, which is severe vomiting, dehydration, and abdominal pain. And finally, the recovery phase, where symptoms resolve with the cessation or the stopping of cannabis. So when can CHS occur? Typically, it occurs in individuals who use cannabis regularly for months or even years. Symptoms often develop in these three phases, which I just meant, the prodromal or hyperemetic phase and the recovery phase. Now, these are common symptoms that you should be aware of. Cyclic vomiting, severe nausea, abdominal pain, dehydration, compulsive hot bathing for relief. This is an interesting one because there seems to be a need in these individuals for a hot bath, and a hot bathing dramatically reduces the symptoms. So if that happens with you, that should immediately trigger the potential for serotonin syndrome. But in addition to the effects of cannabis, one needs to know that there are both a large group of medications as well as nutritional supplements that you can buy right on the shelf in health food stores that could increase one's chances of developing hyperserotonin syndrome. Number one, though, risk factors include chronic cannabis use, a genetic predisposition, and underlying digestive disorders. You know, what's really interesting about the gastrointestinal tract in the brain is that both the GI tract and the brain produce serotonin. And serotonin is a neurotransmitter that's required for lots of central nervous system processes, including sleep and mood regulation. But foods we eat, medications we take, and nutritional supplements can increase the levels of serotonin in the blood, either by enhancing the body's ability to produce serotonin or affecting the serotonin receptors, allowing serotonin levels to stay higher for longer. So let's get into the medications and nutritional supplements that can cause or exacerbate serotonin syndrome. So in this chart right here, what you're seeing are a handful of the most common drugs. For example, Prozac, which is an SSRI, a serotonin reuptake inhibiting drug, which means it keeps serotonin around longer. Another way of saying that is by inhibits serotonin uptake in the blood, so the levels of serotonin will stay high. So if that's the situation and then you're using cannabis, that's an additive effect, and that could lead to hyperserotonin syndrome. And then there is Zoloft and Lexapro, Paxil, Effexor. There's a number of medications, only a few, as I've mentioned, Tramadol, all have an effect directly or indirectly on increasing serotonin levels. So what about nutritional supplements that can increase serotonin levels, potentially adding to the risk of developing hyperserotonin syndrome? Now again, for those of you who don't know me, once again, my name is Dr. Michael Wald, and I've been nicknamed the Blood Detective, and I have a board certification in nutrition. I'm a dietitian, a life coach. I provide acupuncture. I'm a chiropractor. I even went to medical school, although I did not decide to practice medicine, but I did earn my medical diploma, and I use all of that knowledge when I'm approaching people naturally. And many people are on multiple medications, multiple supplements in improper combinations, which can increase one's risk of developing hyperserotonin syndrome, even if they don't use cannabis. But if you use cannabis, you need to be aware. So there's 5-HTP, which is a compound that converts directly into serotonin. There's L-tryptophan, which is a direct precursor to serotonin. Vitamin B6 helps convert a precursor of serotonin known as 5-HTP into serotonin. Even magnesium supports serotonin receptors. Omega-3 fatty acids improves serotonin receptor activity. St. John's wort, which is used for antidepressive effects, for example, works by inhibiting serotonin uptake, keeping serotonin levels higher in the blood for longer. Even probiotics, because they affect serotonin production. And melatonin. Melatonin is made from serotonin. So again, just a couple examples of some common nutrients that could increase one's risk of serotonin syndrome. So having said all of this, I think that the best way to approach a patient with this condition is for them to receive the standard of care. There's a variety of medications used, like anti-nausea medications to deal with the symptoms, IV fluids, for example, stopping cannabis, and also stopping any other medications or drugs under supervision, of course, that have the potential of increasing serotonin levels and therefore one's risk of serotonin syndrome. And we want to look at someone's mood and their diet and their meds. All of these different things, as I mentioned, provide a holistic approach so that a person can have this condition diagnosed properly and also find out the cause or causes of hyperserotonin syndrome. Thanks again for listening to this brief conversation. I hope you found it useful. To reach me with questions or concerns, you can email me at info@blooddetective.com, and there's more information on hyperserotonin syndrome and other topics that are prudent for us to know if you're interested in healthy aging and longevity. And you can find that free info on my website, either under the podcast section or just searching the search bar at www.drmichaelwald.com. Thank you so much, and I'll see you at the next one.